Hi, so in this video, we're going to be talking all about helping you to pass your NCLEX exam in only 85 questions. I know 85 questions, that's honestly the goal, that's the dream for a lot of graduates, so that way you can succeed and, don't have to stress after 85 questions. So I'm going to show you how to do that in this video, so stay tuned and watch this to the very end. All right, so now, if you don't know who I am, my name is Nurse Choma. I'm the founder of Choosing Nursing, and we've been successful, been able to help over 1,000 nurse graduates to pass their boards exam, and we've developed a huge following across social media, when it comes to Instagram, Facebook, TikTok. So if you want to follow more, you can definitely hit the subscribe button or follow me across social media, which is Nurse Choma, Nurse Choma underscore on Instagram. And so we're going to go ahead and get right into this video. All right. So now, if you want to be part of my nursing email list as well, there is where I'll send you more tangible things. So more tangible PDFs that you can download, tips, guides, special promos, things that we're doing. So if you want to click below this video, you can actually join my nursing email list that way. All right. So now let's talk about what it takes to pass your test in only 85 questions. Especially if you feel like you've been really trying and you feel like it's been hard, you don't know what you're doing wrong, what to do differently. I get it. I totally understand. Or maybe the biggest struggle you've been having now is, you've been taking the test, you've been getting 85 questions, but you've been failing, right? So, and in one of the previous videos I talked about is, what it means if you got 85 questions on your test, etc. So let's talk about how to pass in 85 questions. So the first thing is that if you want to take this test and pass the 85 questions, the reality is that you definitely need to know your content. I know it sounds, maybe like obvious or generic or cliche, but the reason why you're not passing, it's revealing that you don't know the content as well as you think you do. All right. You don't know it as well as you think you do, especially, or if you haven't even taken it yet, and maybe you've been doing practice tests, and the practice tests are showing that your percentages are low. And when I say low, I mean, you know, 65% and below, then it's revealing that you don't know the content as well as you think you do. And some of the things you have to do differently now is it's not only just, reading and memorizing. Reading and memorizing is not enough. It's not really, especially if you've been out of school for a while or you've been struggling to understand the material, it's not really enough. You have to be able to differentiate things. You have to know different levels of things. You have to be familiar with unfamiliar terms, right? So what I mean, for example, is knowing like what's the what is the so not just knowing, okay, what is high potassium, right? What is hyperkalemia or what is hypokalemia, but what makes the two different, right? So because the problem is that if you do the test and you're not sharp with what's the difference, you're going to easily be mixing them. You're going to be mixing them. You're going to be picking some for this and some for that, especially with the SATA questions, right? So you have to know the differences as well as the same, as well as what it is. For example, you can know Cushing's disease. You can know what Cushing's disease is and what Addison's disease is. But if you don't know what makes them different, it's not enough. So you need to know differences. You need to know stages or different levels of something, right? So there's different stages of hypertension. There's different stages of preeclampsia, right? So there's different levels of things. So you need to know more detailed information. Usually that's what it's showing. Also, another thing too is you need to know and understand pathophysiology. A lot of people don't understand what pathophysiology really is. They know what the disease is, they learn some of the symptoms, but they don't know the pathophysiology. So pathophysiology is you understanding, okay, How does this disease process affect the body? Okay, that's what it really means. So, for example, if somebody, let's say you talk about heart failure, all right? So, heart failure is a problem where what happens? So heart failure, there's an issue where the heart is not pumping correctly, right? But you'd be surprised. I ask people, okay, tell me what heart failure is, and they'll say, oh, they have problems with fluid overload. They may say that, oh, there's a block in their hearts, which is not true. There's a block in their heart. Oh, they can't breathe. So they're telling me the symptoms, but they're not telling me the patho. So you have to understand the pathophysiology of that disease process. So that way you understand, okay, why does this patient have these kinds of symptoms, but this one does not, right? And then if you know the pathophysiology, then you understand the interventions a lot better. You understand what to treat, how to treat, and why to treat, etc. So you need to know you need to really understand the patho. A lot of times that's what you're missing. You're taking it over and over and over again. You're not retaining it. You're struggling. You keep getting 85 questions and not passing. You're missing something very significant. Although you're studying, although you're doing questions, what you're doing is not the totality. It's not the fullness. It's not the whole picture. That's why you keep coming short. The second thing, number 2, is that now that you know the content, now you need to understand critical judgment. You need to understand critical judgment. So you need to understand, okay, how to critically think. So if you have a patient that presents with this diagnosis and they're having these symptoms, what would you do? Versus if you have another patient that has the same diagnosis, but they're this old, what would you do differently? See that? So critical judgment is where you can take the information that you're given and be able to apply it to each individual scenario. Or you are able to recognize what additional information you need in order to treat the patient appropriately, right? So being able to think critically. Sometimes you can pull up your critical thinking from practice questions, but it honestly takes a lot of time to do it that way. It takes a lot of time, it takes a lot of practice, and it can be very overwhelming. So I would recommend, if you need help with critical thinking, the best thing is to either attend a class, do a course, read some books that focuses specifically on critical thinking. Especially if you keep taking the test and you keep getting near passing, then critical thinking is the problem that you're struggling with. The third thing, number 3, is of course to do practice questions. Doing practice questions to reinforce your learning, so that way you really understand the material. So that way, to reinforce, not to constantly learn new information, but to practice, practice, practice. So for example, you learn all the different heart problems, and then you do questions. You learn all the nursing procedures, and then you do questions, right? So like that, you're reinforcing what you're learning. And that's also building up your that's building up your critical thinking, and that's cementing your content. That's solidifying it. So you're doing those questions on top of everything else. And you notice too, I told all this to you in a specific order. A lot of times the reason why people don't pass is because they're doing these things out of order. So do the content first, critical judgment next, then questions. That's how you'll be successful, so you can really pass this test. If you have questions, you can comment below this video, and we can address your questions. If you know you need more help, go ahead and click below this video for resources that we have. You can go to the link in the bio, below the video, above the video. Go to bit.ly/choosenursing shop to access our classes, courses, audios, PDFs, so that way you can become successful. All right, so you can become successful. And for those that live in Africa, you can use the code Africa for a special discount. All right, so go ahead and comment below, like the video, subscribe. Let me know what you took away from this video, and go ahead and stay tuned and watch this video for more information.
If you're finding this video helpful, then you're definitely going to want to watch my free NCLEX webinar training, where I reveal what are the real-time secrets that I'm currently teaching my students that results in hundreds of repeat test takers finally passing the NCLEX exam. This is a training where I walk you through step by step what are some of the common myths and mistakes that you may be making that is resulting in you not passing your exam or not passing it when you do take it. In addition, you will get a free PDF bonus that will narrow down your focus so you know what to start doing right now to ensure you pass this test regardless of how many times you have taken it or how long you've been out of school. By the time you are finished with this training, you'll know exactly what you need to do so you can secure your nursing license and land your dream nursing job. Simply press the free training link either above or